Do you have dreams of becoming a registered nurse? But the thought of ABG interpretation has got you a little nervous. Try this method. Draw 3 horizontal lines and 1 vertical line. Label your values: pH, CO2. Remember, CO2 is the respiratory system. HCO3. HCO3 is the metabolic system. Label your acid and your base. Now write the normal ranges: 35, 45, 45, 35, and 22 and 26. Now don't forget to reverse your CO2 values so it reflects your acid and your base. Now you're all set. Let's interpret this ABG. First, plot your numbers. pH is 7.25, CO2 is 55, and bicarb is 24. Note where your players are. pH and CO2 are on the same side, and your bicarb is still on the line. The closest player to the pH is respiratory, and it's on the acid side, so our interpretation is respiratory acidosis. But note what the third player is doing. He's on the line, so it's not compensated. It's doing nothing. Let's try another. Here's our setup. pH 7.48, CO2 is 30, and bicarb is 20. Note that CO2 and pH are on the same side, and the bicarb is off the line. Pair our players together: respiratory alkalosis. And then our third player, he's off the line. He's going to work. It's partially compensated because the pH is still abnormal. To my future RN, keep your dreams alive. You've got this.